Hi everyone, today we are going to be going through a level 1 Botox treatment. So starting off, we're just making sure our patient's skin is clean and prepped prior to going in with our neurotoxin. And then we're going to go ahead and mark up. So this patient is treating her frontalis and her glabella. So starting off with the frontalis, this is the only muscle that is elevating up our eyebrows. So when you're choosing your dosing, you want to make sure you are going based upon your patient's anatomy and not just picking a standard dose. So we marked the frontalis and we marked the glabella as well. So that's the 11 lines and a little brow lift here. The patient does have heavy eyelids. When we kind of have her open her eyes and look at it from the side, you can tell that she has some hooding. So that's another factor to take in consideration when you're choosing your dosing for your frontalis. If they already have heavy eyelids or they feel as though they want their brows lifted, you want to make sure you're picking a lower dose for the frontalis to avoid the heaviness. And of course, dose equals duration. So you always have to have that conversation with your patient. Maybe the toxin isn't going to last as long. But if they're extremely uncomfortable with their dosing and it's too heavy, there's a problem there as well. So again, it's all about choosing something that's appropriate for your specific patient. Everyone is going to be different. So now going in and treating our 11s or the glabella, that was our Proceris injection, and then 2 injection points for her corrugators. The glabella is a depressor muscle, so it is pulling down. So the heavier we treat here, the longer it's going to last, the longer duration, and it's also going to help that patient's eyes feel more open. It helps give a medial brow lift. And then we are also going in with a lateral brow lift with just a few units here right in the arch of her brow. This is a very superficial injection, and we want to make sure that we are keeping it superficial and choosing the correct spot according to her anatomy prior to injecting to avoid any ptosis. And we'll go ahead and clean her up, and her results will start to kick in within the next 2 to 10 days.